So it's really a great pleasure and honor to introduce who are now my old friends, Vicki and David Tallen, who, oh, Garrett, I'm sorry, I'm distracted. Colleen Tallen is their doctor. That's David, that's Vicki, whom I met at the CAPC National Seminar last fall when they incredibly generously agreed to come and speak in front of a room of 950 people about their experience with a serious medical illness and the role of palliative care during that serious medical illness. And Colleen, my colleague in palliative medicine, is the person who helped us find Vicki and David and who has cared for them for a long time. So first, let me again just say thank you and express my deep gratitude to you for schlepping all the way to Washington and sharing your story with us as a way to get us grounded in why this work matters. So, Colleen, would you mind just beginning to tell the story of how you met Vicki and David?
Yes, I would. So Vicki is a really wonderful nurse who was practicing as an OR manager in 2014. And in November, she became short of breath. She was getting ready for the holidays, Thanksgiving, didn't think she was sick. Went to the emergency, in fact, it was coaxing of some colleagues at work who got her into the emergency room to find that one of her lungs was filled with fluid. And in treating that, she was diagnosed with mesothelioma. That is a lung cancer that has a very bad prognosis. And that was going on almost 2.5 years ago. And I think I'll leave it at that so that Vicki can tell her own story. But that's how the story started and how palliative care got involved in her care.
So I'm going to apologize right up front. Speaking in front of a crowd makes me nervous.
Join the club.
But more importantly, speaking about my disease. Whether I'm talking to my family or I'm talking to you. So my story, as Dr. Tallen said, started on November the 14th. And like every other day, I'd gone to work with plans to go to Florida the next day for a much needed 2-week vacation. The hospital that I worked at, a Catholic institution, had an executive meeting. And they asked those of us who were capable of walking, because they were holding the meeting 2 blocks from the hospital, would we please walk so that they would save parking for our guests and our physicians. So I was healthy. There was no reason why I couldn't walk 2 blocks. It was a light, misty rain, and I was walking with a friend. And as we started that walk, I became increasingly short of breath to the point that I thought I was going to have to sit on the sidewalk because I just could not take another step. My friend was not a nurse, and she kept saying to me, I don't know what to do. I don't know how to help you. But she finally got me to where I could get help. And I walked into the meeting, and there must have been something about the way I looked, because my boss came up and said, we're going to the emergency room. And I said, no, we're not. I'm fine. I just need to sit down for a minute and catch my breath. I don't know what's going on. But if you knew Liz, you know there's no telling her no. So she put me in a car and away we went. And I got to the hospital and the ER couldn't hear anything in my lungs and they couldn't understand why I was short of breath. And they were about ready to send me home. My O2 stats were fine. My lung sounds were okay. What the nurse didn't understand is that she wasn't hearing any breath sounds in the lower left lung. She was only hearing breath sounds in the upper part of the lobe. And so a very nice ER doctor came in and said, you know, to be on the safe side, let's just have you get an x-ray. And so I did. But first I called David and I said, you know what, I'm in the emergency room. I don't know what's going on. I'm fine. He was at work 40 miles away. I said, you don't need to come. I'll be home for dinner. Well, I went for my x-ray and the ER doctor came back and she said, do you think you could take a walk with me? Sure, I'm fine. How soon can I go home? And she took me in and she showed me this x-ray. And being a nurse and being a surgery nurse, I knew what I was looking at. And the words out of my mouth was, call the thoracic surgeon. He was my friend. We'd worked together for years, and I don't know where he is, but when you tell him who it is, he'll come. And then I called David. I said, you know, maybe you ought to come. The first time they took 1,300 cc's of fluid off my lung. And then the next time they took 2,500 off my lung. And my thoracic surgeon, I was so scared. He could have told me to jump off the building and I would have done it. But he said, well, we're going to fix this. We're going to do what's called a VATS procedure. And if you're not familiar with that term, it's a video-assisted thoracoscopy, where they go in and they put talcum powder between the wall of my lung. And so medical professionals, you know all about that. But what he never said to me was, maybe there's another option. Maybe you don't have to do that. I trusted him. I didn't ask any questions. I was too scared to ask questions. While I was in the hospital, in my position, I knew a lot of people, and a lot of people knew me. And a lot of my nursing friends, even though they probably shouldn't, had access to my medical records. And so they were coming into my room, and I kept saying, you know, we don't have the diagnosis yet. I don't know what you're so upset about. Let's wait until we get the diagnosis. And so I waited, and finally the doctor came and gave me my diagnosis. He walked in the room. He told me what it was. He told me I wasn't going to live, that there was no cure. He gave me an approximate time, maybe 18 months. He said, and I don't believe in miracles. And he walked out of the room. I didn't know what to do. I was so scared. So I withdrew into myself. I elected not to have any treatment. I finally met with my oncologist, who is the most wonderful individual. My thoracic surgeon wanted to take out my lung, but my sorry, breathing doctor, pulmonologist, thank you, put me through all kinds of tests and said that I didn't have enough lung capacity on the right to be able to take out the left, that it would be too risky for me. And we talked about what were my options, and what we decided was I was going to come to Florida, and I was going to try to get my head together. But in the meantime, he made arrangements for me to be followed by Colleen and sent me to see a specialist. And the specialist said to me, your only chance is to take out that lung, even though I'd been told I shouldn't, that it wasn't. And he said, you got 2 days to make up your mind. And walked out. Well, I did the only thing I knew to do. I called Colleen. And she and I have been together this whole journey. It doesn't matter what time of the day or weekends. When I need her, she's been there for me 100% of the time. She's never said it's an inconvenience. Don't you know it's Sunday afternoon? Don't you know it's Saturday night? She's walked with me. So the good news is I had a CAT scan done about 7 or 8 months ago, and it showed that my tumor was stable. And I had another CAT scan done just a couple months ago, was in February, and it said that my tumor is stable. It has shown a little bit of growth, but as my oncologist says, it's not growing like a weed. So I do believe in miracles. David and I come from a religious background, but this journey has really increased our faith. And we're able to tell other people, look at your options. Ask questions. Don't be afraid to ask questions. Doctors can only tell you what they see on an x-ray, but they don't know what you're capable of, the strength that you have, and they don't know your family support. And I couldn't have done it without my family support. He's been with me every step of the way through periods of anxiety. When I came to Florida the first time, I came to die. That's what they said. And I believed them. And then Colleen said to me, you didn't come here to die, you came here to live. And it doesn't matter, because nobody knows what their future holds. Is it 1 day or 2 or 10 years? No one knows. And so I took her advice. And I remember that first Christmas when David was pushing me. And my answer to him was, why bother? Why bother? But that's been more than a couple Christmases ago. And I'm here today to tell you that medicine is good, and you need to be connected with your physician, but he needs to listen to you and you need to listen to him. And there needs to be two-way conversation. And patients can't just jump on what the first thing the doctor tells them, because that's exactly what I did. And I was a nurse. So often I talk about the people who aren't nurses or who don't have family connections. And they're out there struggling. I've known Colleen for many years. We worked together in Grand Rapids, and I was so lucky to be connected with her when I came to Florida. But I can tell you, she's been my lifeline. So I believe in palliative care. I totally believe in telling the patient to live. I don't think you should be dishonest with your patients. I do think you need to tell them the truth, but I think you can do it in a way that doesn't scare them to death. And it doesn't shut them down.
Thank you. You said it all. David, you're in the role of the all-important family care. We call them family caregivers, but you're in the most important role for supporting a person. I wonder if you could tell us a bit about your journey and what it's been like.
Well, the first thing that I recall about this situation on the day that they discovered the mesothelioma was I was waiting for the doctor to come out of surgery, and I knew he was going to come and share with me what he had discovered. And as Vicki said, we come from a faith background. And I had a pretty positive outlook about what I thought the doctor was going to have to say. So he came out, and we went in the conference room, and he pulled out a picture that they had actually taken that showed the tumors. And he pointed to them and said, "Do you have any idea what that is?" I'm not sure why he thought I would, but nonetheless. And he proceeded to tell me that it was mesothelioma, and he proceeded to tell me that it meant that she didn't have long to live. Well, needless to say, my world came crashing down rather quickly. So when I finally went in and was able to see Vicki, I had an experience many years ago with my mother. She had lung cancer. And when the surgeon came out from tending to her, and he met with my father and I, he shared with us that it was cancerous. And he said, "But we're not going to tell her." And I couldn't believe I heard what I thought he said. And I looked at him and I said, "You got to be kidding me. This is her life we're talking about. She has the right to know exactly what she's dealing with." And he wasn't very happy with me, but I really didn't care, because I believe very strongly that my mother had the right to know. And so we did tell her very soon. And I never regretted that. So Vicki and I talked about it. Again, they were waiting on lab reports to verify. But I didn't hide anything from her. We just discussed it openly. And as we talked, I shared with her that even though the news had not been very pleasant, there was still a part of me that believed that, as I referred to it, she was going to have a very positive testimony. And you know, 29 months later, I still believe that. I still believe that. But the reason we're here today is to talk about how do we deal with patients and families who are in this situation. And you can imagine leaving a doctor's office, and I had met the gentleman, and he was a nice man, and I'm sure he's still a nice man. But when he, out of the clear blue, looked at the two of us, and again, there had not been any discussion whatsoever that led to this, and said to us, "I don't believe in miracles." My first reaction was, so what? You know, but it really was a stunner. And then the next thing that comes into my mind that I remember is we're walking in to Dr. Tallen's, or as she said, call her Colleen, Colleen's office. We're standing in the waiting area, and here comes Colleen through the door, moves immediately to Vicki, throws her arms around her, and I'm standing there saying, wow, what a difference. What a difference. And Vicki's already told you that the thing that really made the difference for her was when Colleen, once back in the office, said to her, "This is all about living. This is all about living. We're going to work with you to live." Now, Vicki didn't tell me when we first went to Florida. By the way, we chose to drive that from Michigan, and that wasn't a very wise decision, but that she was going down there to die. She never told me that. Obviously, my mind, my heart were very heavy. I would wake up many times in the night, and I don't know that I've ever told her this. I'd wake up many times in the night, check her, make sure she was breathing. But from the moment that Colleen presented to her this wonderful notion that we could choose to live, it made a huge difference for both of us. And we are eternally grateful to her, to the oncologist, the palliative care people in Michigan, because they truly have made a significant difference in the last 29 months for us. Thank you.
All day, but we can't. So,
You'd get bored.
no, we wouldn't. So we are going to ask you to come back up during the Q&A session for this morning, if you don't mind, so that the audience can have a dialogue with us. Is that okay? And in between, we'll hear from two of our speakers. So thank you, thank you, thank you.